Hello, this is Dr. Mark Hassard, the Relaxed Dentist. I want to talk to you today about clinical notes and who does them in your office. Now, as I travel around, I see most offices the dentist is the only one who does clinical notes, and I think that's a big mistake. Ultimately, the dentist does take responsibility for the notes and has to check them and verify they're correct, but who actually enters them in the computer? Well, I think a well-trained staff person is the best person to do that, and I'll tell you why. When I go into an office where the dentist is doing the notes, I see either one of two things. Either they do a very rushed job of it, that is, they just quickly dash down a couple of little things, leave them very incomplete, because they need to get on to the next patient. They've got a patient waiting and they don't want to sit there typing up notes for 10 minutes. Or the other thing I see is they come back at lunchtime and then they're trying to fill in their notes at lunchtime. So instead of getting to relax and decompress and have a relaxing time at lunchtime, they're sitting there typing up notes right through their lunch hour, or they stay back after work. But the big problem with that is that an hour, 2 hours, 3 hours after the event actually happened, who can remember exactly what you said to the patient and exactly what they said to you? So my methodology for doing notes is really simple. You get a well-trained staff person and they actually take the notes as the conversation is occurring. So when I'm talking with a patient, if a patient asks me a question, immediately the staff member, patient asks the dentist such and such, typed straight into the notes. And then I reply, I say whatever I say, and then my reply is typed straight into the notes. And so in doing it in that way, you get a really precise, accurate set of notes that contains everything that was said, but you're not hanging around in your lunch hour or after work to do it. And it's just so much more complete, so much easier. And also, of course, then you can just get straight on to the next patient. You're not having to constantly sort of sit there and waste time with this. So I think get a well-trained staff member, train them well, and then it frees you up for an extra hour or two clinical work per day, but also your notes will be better because of it. I'm Dr. Mark Hassard, the Relaxed Dentist.